We are so excited that you are here. As you guys join in, be sure that if you have a question, you can write them in your chat, in the chat feature right there. And we will be live as we discuss your questions. Hey, being pregnant is really hard to navigate through in normal times or so. Are times ever normal? I don't know. But normal times, it's hard to navigate through. But now, can you imagine navigating through a pregnancy through a pandemic? That can be hard for thousands and thousands of women all across the United States. Well, that's where LunaYou comes in. LunaYou is a maternal well-being program designed for you. In LunaYou, we come alongside you and help to empower your well-being and really create a whole model around you, from a circle of support to helping you contact, identifying what support is around you, helping you find your voice from within, as well as our well-being dashboard. And so that's what LunaYou is about. I have a good friend of LunaYou here with us, joining us for our time together. Giselle Bello, she is here.
Hi.
I'm going to let her introduce herself, but she is a powerhouse and she's very knowledgeable about women's health. And she's here to kind of help us navigate through and answer some of those questions that we've been getting through LunaYou. At the end of this, we have a special treat for all the women that are on that could benefit from something great. If you guys just stay tuned and stay plugged in through the duration of our conversation. So this should be a really great conversation that we have. But hey, Giselle, thank you so much for coming and being with us. Can you just introduce yourself a little bit and tell us a little bit more about you?
Hey, girl.
Hey.
Or hey, all girls out there. My name's Giselle Bello. I am a third-year medical student at Brown, and I am interested in everything women's health. My future is to be an OBGYN. And currently, as Courtney mentioned, I'm involved with LunaYou. I also help run a free women's clinic from Clínica Esperanza. And that all of that happens in between me studying and trying to learn all about everything every day.
Awesome. So you're right there with us in dealing and navigating through the stress of all things COVID and trying to live a seemingly normal but healthy life.
Right.
So with that said, let's start off with our first question. These are some questions that we get from the women that we already work with and that we already kind of see and talk to on an everyday basis. But am I at more risk for COVID since I am pregnant?
So that's a big question, specifically because, like you mentioned, being pregnant in general is kind of a stressful time, let alone in a global pandemic. And so it's also a big question because this is so new, we don't have as much data on as we would like about COVID and pregnancy. So currently, the available data on COVID does not indicate that pregnant women are at an increased risk. However, pregnancy is a period of suppressed immunity, which is normal because you're growing a human inside of you.
And let me pause. So can you explain suppressed immunity and like what that means?
So when a person is pregnant, their immune system, because you're growing a baby inside of you, is not as high functioning as it normally would be, which is normal. But because of that, especially during these times, pregnant women are known to be at greater risk of having other respiratory infections such as the flu, which is why a lot of OBGYNs encourage pregnant women to get the flu shot, because you have this period of suppressed immunity, which is totally normal because you're pregnant, and because the flu can be something that is really difficult to deal with. And so now that you have something like COVID-19, although we don't have specific data that tells us whether or not pregnant women are at super high risk for this COVID-19, in general, the thinking is that pregnant people should be considered an at-risk population for it, although we don't have concrete data that says yes or no right now.
Yeah. Listen, thank you so much for that. Great. So understanding what suppressed immune system are. So you might be more susceptible to colds and different things. And
yeah,
you want to put like We're just giving you information that is found on websites. And so we have tons of
Right.
resources available to you where we got this information from. And then also, it's important to know that please see your healthcare provider with any questions that you have that are specific to your situation and specific to that. This is just us telling you in a conversational way how we're
Right.
going to navigate through this and kind to talk at some of the hot topics going on around pregnancy and COVID-19. And so,
Absolutely. And I think that one of the things that we can certainly do is gather all of these links and resources and post them somewhere so that people who maybe weren't able to tune in or have further questions can go and find the information themselves. As you mentioned, we are sort of relaying this in a non-medical sort of conversational way so that people can um, tune in and get information.
absolutely. We'll put these resources on our Facebook page, I am LunaYou, as well as our website, www.lunayou.com.
Yeah.
Can access them. So, speaking of that, does coronavirus increase my risk for preterm labor or even having a miscarriage? And then, together with that, can I, let's say I test positive for COVID-19, can I pass that on through my best breast milk to my baby?
hmm So again, I think all of these questions are going to have to be answered with like a caveat that we don't have as much data as we would like. But so specifically with the first question about preterm labor, miscarriage, there are many factors that lead to preterm birth, which are individualized to each woman and her other health conditions. Preterm birth has been reported among infants who were born to mothers who were positive for COVID-19 during pregnancy, but the information is, again, based on limited data, and it's not very clear that the preterm birth happened because the mother was infected with COVID-19. As I mentioned, many factors lead to preterm birth, such as high blood pressure and previous preterm deliveries and diabetes and things like this, which makes that question more of an individualized response for each woman. But currently, it's not clear that COVID-19 can pass from the mother through the placenta to the baby. And oh, go ahead.
Go ahead. No, no, go ahead.
No, I just wanted to give some pause before we move on to the second question,
Okay.
which was about passing COVID-19 through breast milk.
Hmm.
And so breastfeeding is still very encouraged as it's a great primary source for nutrition for the babies. And what we have, the data that we do have suggests that COVID-19 has not been found in breast milk. So breastfeeding is still encouraged. If you are having symptoms or if you are positive of COVID-19, definitely wash your hands for the 20 seconds as is advised before you touch the baby. And if possible, wear a face mask while breastfeeding. Also, cleaning all bottles and breast pumps and anything that sort of would go from you touching to the baby consuming.
Yeah. And you
Yeah.
and can you expound a little bit on the face mask? So of
Mhm.
course when you're around the baby, definitely great hygiene in terms of washing your hands, sterilizing
Mhm.
bottles, all surfaces that the baby might touch. But then also like face masks as we just kind of like navigate through whether we have to go to the grocery store or just
Mhm.
outside for just a quick fresh breath.
Yeah. So that's something that a lot of people have been very confused. I mean, I don't think you have to be pregnant in order to be confused about whether or not to wear a face mask right now,
Yeah.
especially because there's sort of been confounding um, information out there that says everyone should wear a face mask, no one should wear a face mask, only doctors should wear face masks. And as of lately, the thinking is that we should be wearing face masks, definitely while you're going outside. I mean, the way that this virus spreads from what we know of right now is by direct contact with someone. And I know they're talking about it being aerosolized, so being in the air around you through respiratory droplets. So that's why they're saying to keep at least 6 feet distance from anyone when you go outside for a walk or when you go to the supermarket. But generally, the thinking is that we should be wearing masks if we are able to find them, because I know there's a shortage of them as well. Uh,
Awesome. No, those are really great tips, and I hope you guys are writing these down. And just feel free to engage with us with hashtag I am LunaYou or LunaYou so that we know that you guys are listening. Another big thing now is I know that a lot of the hospitals and the healthcare centers are limiting the number of visitors that you can have at appointment. So
yeah.
a lot of them are saying no visitors with you at appointments.
Hmm.
And then also, what about when a woman goes to give birth here
Hmm.
particularly in Rhode Island? Are there any regulations or anything that that woman should know about?
Yeah. So dealing with pregnancy in general, especially not being able to bring someone with you in appointments, is hard in itself. But what I would say regarding appointments is if you have a scheduled appointment, I would say call ahead of time to ask your office, what is the protocol around me coming to this appointment? Should I come to this appointment? Is there a way that I can just talk to my doctor on the phone and sort of have my appointment in that way? Because a lot of offices have been transitioning to telehealth to sort of flatten the curve, as we've been saying. So you can do that. But if you have to come in, I would say call ahead of time, ask them about what are the protocols around making sure that people are kept safe during their appointments. And also whether or not you should bring your own masks or if that's something that can be provided there. And then also about whether you can bring a person or not to your appointment. I think it's being sort of chosen by each clinic. Some clinics say you can bring one person. Some clinics say no other person besides the person who's coming for their appointment. So that's another reason why you should call ahead to sort of understand what their protocols are around that. So call your OBGYN or your midwife or whoever you follow with. With regards to labor, which is terrifying without someone who's your support person there. So I actually called Women and Infants this week because I wanted to make sure that I gave you guys appropriate information. And so Women and Infants, if you are birthing there, you can bring one support person with you who can be with you the entire time that you're there. Um, and that's definitely less than we would have been able to bring before, but having one person is certainly better than being
Yeah.
by yourself.
Absolutely. And thank you. And just to clarify that Women and Infants Hospital is based here in
In
Providence.
Rhode Island, yeah.
Yeah, so just for those that are out there, but thank you for that. So definitely call your healthcare centers. Another best practice tip I have to piggyback off that question is going into your appointments. If you cannot bring anyone with you, if you are still physically going into appointments, is to ask your healthcare provider if you could record the appointment, like voice record
Hmm.
the appointment or video record the appointment so that you can share with your support group, your circle of support, your family, your friends after the appointment is over so you can be sure that they get all that information as well if you feel like you can't remember all that was said and
Hmm.
want to look back on it. And so if you are part of LunaYou, we in our comprehensive app, there is a spot for notes. There's a spot to, track and write everything down that the doctor is saying so that you can follow up with it on the next appointment. So just a best practice tip in there. Um,
Yeah.
just so
And
that
also,
Mhm.
just having your questions written down, I think, beforehand, so that if you do have to come in, you have questions that you uh, have for your provider and you don't forget to ask them, because I mean, I can't keep track of even what day it is nowadays with this quarantine, let alone like questions that I would want to ask my healthcare provider.
Yeah, and do you know, so you said that women and infants will allow like one support person to be with you. Do you know if they are free to like enter and go, or do they need to stay with you throughout the duration of?
So I'm not sure about that actually. I was just sort of like really interested to see if you could have someone with you.
Yeah.
Um, I would think that maybe, I mean, I don't know. I think maybe it would be best if the person could just stay with you the entire time, just to sort of minimize any exposures or any hassle, I think, on the couple or whoever's part.
Yeah, absolutely. And definitely I would think it would be a case by case basis
Mhm.
as well. And so really asking your provider or the hospital itself whether or not that would be acceptable.
Yeah.
So moving along and kind of shifting gears to now more wellness. So a lot of us are confined to our homes to just be quarantined and to stop the spread. Um, it's really important we know that when we did a lot of research through LunaYou, that one of the things that factors into your well-being is you physically feeling well and being
Yeah.
active. So what are some solutions to being active while we're quarantined and pregnant?
Mhm. So a lot of apps that have workouts have been rolling out free editions of their apps, so people can be able to use them, because everyone sort of understands that we're quarantined and held in our houses for good reason. But so one of my favorite ones right now is called Down Dog. It is a yoga app. And they're having their app be free to everyone, to the public, up until June. Um, Hopefully this will be done by then, but that certainly is one that is really great to use. You can tailor the kind of voice that you want to hear while you're doing yoga, the kind of music, what are the things you want to work on. Sort of lower back, I know with pregnancy a lot people get lower back pain. So you can sort of tailor what it is that you want to work on and how extraneous you want the workout to be or more relaxed. It kind of lets you customize your workout the way that you want to. Um, and there's also free meditation apps. Specifically, the one that I've been using myself is called Headspace. And they also have rolled out a lot of meditation sessions that are free for the public to use and are also sort of the content is tailored to the fact that we're dealing with a global pandemic right now. So, sort of giving you some strategies when your anxiety gets a little bit out of control or you're just feeling really scared and things like that. That also lets you customize what voice you want to hear versus another voice, because I know sometimes that matters, or at least it matters to me.
Yeah, me too.
Yeah.
That's awesome. Those are all great tips. I know that YouTube has tons of like
Mhm.
prenatal workouts that you
Mhm.
can access for free. And Rhode Island, I just got the email from the Department of Health and Governor Raimondo where she's saying that if you have a large carrier like Verizon, AT&T, Sprint, like those big carriers, they're allowing you to use your hotspot for Wi-Fi. So you'll be able to access that and have that
Oh,
Wi-Fi
good.
if you don't have Wi-Fi connection. So that's another cool tip. YouTube. We know that fitness trackers as well as things on
Mhm.
your phone that track your activity to see your steps, getting up, doing the housework, doing a lot of things to keep you active, being
Mhm.
competitive with some of your family members that are quarantined with you are really great steps to stay active and to stay well during this time and to kind of spice up your day a little bit.
Yeah. My mom recently told me that she walked around the house, like circles around the living room for
Oh,
like
I love that,
45
like, make
minutes.
the house a track. That's
Yeah.
that's so awesome. I like that. Yeah, so turn your house into a track.
Yeah.
So that's a good thing, and probably have, like, a walking buddy to come walk with you. That's
Mhm.
good. No, That's really good. And also if you have a toddler, I have a toddler at home, and so he my steps going,
Yeah,
we go.
they'll keep you busy.
Um, so and with that, so of course this is very high anxiety inducing times. It's just like very uncertain. A lot of people may have lost their jobs recently,
Mhm,
or
mhm.
their jobs may have been put on pause. Some people are working from home and homeschooling other children, as
Yeah,
well as being pregnant. And so there's a lot of life changes and a lot of events that have happened in such a short, quick time, which can create a lot of anxiety. And we already know that pregnancy already has
already.
tons of anxiety that comes along with it. So can you help us? And this is where I'm gonna like before we even get started, where LunaYou kind of comes in. We are all about focused on the well-being of a woman that is expecting. Right now, we're focused on women here in Rhode Island that are on Right Care, which is a Medicaid program. And what we do is we come alongside them with well-being coaching, where a woman can talk about her appointments to family support, to identifying things. She can have SMART goals that will help her to increase her activity or her nutrition or whatever it is that she wants to accomplish throughout her pregnancy that contributes to her being well. There's lots of programs out there that focus on the baby, but not enough that focus on the mother. And it's
Mm,
really, really important when we focus on the woman that her whole entire, when you focus on the woman, we know that the whole entire family unit is well when the mama is well. And so
right.
that's what LunaYou is really all about. For a limited time while we're going through this crisis, we are offering free wellness coaching to women on Right Care, just to get those check-ins to talk about things that they might be going through that they may not can share with a support person, or help them to really empower and finding that personal power within themselves to advocate for themselves, of just saying like, hey, I'm really frustrated, this is not how I see at the time where I'm going to give birth going, or this is my baby shower got canceled and I'm really bummed about that. You need a coach to really help to walk alongside you. And so that's really where LunaYou comes in to really help to navigate through this time. And then also, if you do live in Rhode Island, you are a part of Right Care, we would love to help you in a further way to walk alongside you to be a part of the LunaYou program. But what are some things that you have that will help to curb some anxiety among women who are expecting in this time?
So you already took my first answer, which was of course, which is of course LunaYou. I think especially with the circle of support, I think one of the things that is really helpful right now for everybody, but specifically when you're pregnant, is sort of knowing that there are other people that are having these similar feelings that you're having, and there's sort of some community there with these emotions that you're having, and everyone feels better when they're like, oh, it's not only me. And then also, you were about to get me on a whole nother tangent because I know you and I have spoken
I
about,
know.
how we need to make sure to take care of the moms that are such a foundation to families and communities. And, you know, 1 6 week appointment after you've given birth is not enough, and all of this other stuff. But that's a different talk.
That's our next talk.
Right. To get to your question though about wellness tips, so certainly LunaYou, especially like you mentioned, if you are in Rhode Island and have Right Care, joining those circle of support groups and stuff absolutely would be one of the things that I would do if I was pregnant. Um, I think one of the things too, I think the reason why being inside sort of feels so difficult is because we're so used to having schedules and going outside and having X, Y, and Z thing to do by the end of the night, and then everything. So as much as you can, create a schedule for yourself, even if it literally is shower, make breakfast, you know, change the kids, or like work out a little bit or do some homework, check in at work, do some laundry, just sort of start your day with an agenda of what it is that you want to accomplish for the rest of the day. And I know it's not the same as like going outside and like bumping into friends and doing things that you normally would do in your regular day, but creating a schedule sort of gives your mind something to look forward to, something to accomplish. Another thing, as much as being on social media is a way to sort of feel connected to people, I think right now, specifically, unplugging or minimizing the use of social media, um, because this is a hard time for everyone. Everyone is talking about COVID-19, everyone's talking about what they miss. Um, Everyone's talking about people who have passed away from this, and I think that it might do the opposite thing, which is increase your anxiety instead of sort of making it uh, less making you less anxious. The other thing is something we talked about, which is like exercising or sort of moving, finding ways to move your body, even if you're inside in the house. Walking, definitely wearing a mask if you walk, if you know people are going to be around. Doing some yoga. My favorite thing when I'm feeling stressed out and I know that I can't leave the house is just to like turn on whatever music and have a little dance party to myself, even if no one joins in. But just, dancing, moving around, sort of letting all of this energy, like anxious energy, out in some way is helpful.
Yeah.
Journaling is also good, to sort of get those feelings out, connecting with your loved ones on the phone, or if you can, through FaceTime or Zoom or something. Um, what else? I would say connecting with your baby, sort of remembering that a lot of the things that you feel, your baby can certainly feel as well. And sort of, if remembering that you're growing this little baby in you makes you, more apt to take care of yourself and to sort of be well, then certainly do that. Um, Another thing is connecting with other moms that are also pregnant and going through the same thing, that have the same concerns as you do. Specifically, just there's an organization called Black Mamas Matter, who is having their Black Maternal Health Week, in which they're going to be doing a lot of workshops, specifically centered around maternity. They have a webinar that is called Black Maternal Health and the US COVID Response, centering Black mamas in practice, things like this, that you can sort of build a community and find people to speak to about what you're going through.
Yeah. Yeah.
Yeah.
Those are all good tips. And I know you talked about like limiting screen time because there's
Mhm.
so much like information that is out there. So how do we differentiate between, and this was a question that just came in,
Mhm.
between like the disinformation that is out there? Like how do we like
Yeah.
determine whether this is real or if this is fake news, so we say?
Right, right, right. Um, so I would say if you are able to get your information from news sources, um, specifically, like, I don't know, I listen to NPR, for example, which sort of distills the information that you need to know into minute and a half stories. I know, like, the New York Times, for example, has current coronavirus information. CNN does as well. So, sort of not necessarily going to Facebook or other social media to get your information. I think the more accurate and up to date information will come from news sources. And again, because this is something that is new, this is a virus that we've never seen before. Um, one week they'll tell you something, the next week they'll say something else, and sort of uh, having a little bit of an open mind around that, and understanding that we are learning just as quickly as like this virus is allowing us to learn, and that information is being put forth to the public. So yeah, just with regards to fake news and things like that. I would say to sort of follow a more like unbiased news stream, like for example, the New York Times, I feel like is helpful with that.
Yeah, I think dates are too they're important, like the dates the article was released.
Yeah, yeah.
Because I've
Mhm.
noticed a lot of times people just put like a newer picture up, like a current picture, but the date would be like from 3 months ago,
Right.
and it kind of sounds relevant, but it's not relevant.
That's true.
And so, really fact checking everything. Go to a trusted source that you absolutely know. That's like a larger
Hmm.
trusted based that produces news that you see there. And so checking the CDC
Mm,
website regularly is very important. They
gonna
keep
say
it
that,
really
yeah.
up to date very well for any questions that you have in different areas, especially around COVID-19. And so that is a great resource if you want to get your information directly from there. And then calling your healthcare provider.
Definitely. That
Um,
that was a good point. I think it's so easy to sort of share articles, but then they're like 7 years ago, and you're like, oh, this makes no sense for now. But yes, the CDC, calling your doctor, news sources like the New York Times and stuff like that. And also because we are, after all, speaking to pregnant people, ACOG has a frequently asked questions specifically around COVID for pregnant patients. And so we can put that up and make sure that
yeah,
people have access to that.
ACOG. Yeah,
ACOG. So that's the
ACOG.
American College of Obstetricians and Gynecologists. Um, and then there was two other things, or one other thing that I remembered that I wanted to say, that people that we're speaking to right now are certainly still pregnant, and they still have to deal with whether they're a first time parent or a second time parent, or however many times you've been pregnant. I think each time brings its own sort of questions, and sometimes you forget things and all of that. So I wanted to just like make sure that everyone knew that YouTube has a lot of childbirth education classes that are free, and available for everyone to be able to take a look at, so that you can continue to be pregnant and learn and sort of have some questions answered about maybe what it would look like to go into labor, or how big your baby is this particular month, and things like that.
Yeah, that's amazing tips. Definitely. Research would be your best friend. And we have tons of those resources on our website too, LunaYou.com, just about like breastfeeding,
Mhm.
different things. The CDC website links directly on our page too, so that you can hear. And then we have access to great people like Giselle,
Yeah.
who are in the healthcare field and that serve as our advisory team. And they have been so helpful during this time to help the mamas that are a part of LunaYou. That's the end of most of our questions that we have. Again, we are from LunaYou, which is a maternal well-being program designed for you. It's designed to really help in your well-being and support your well-being, help you find personal power within yourself to speak up for yourself and put you back in the center of your pregnancy. This is still a
That's
good
right.
time. Having being pregnant, it's still a great time. You're still growing life, and it's remaining positive and thinking of those great things. For any other medical question, please feel free to reach out to your healthcare provider again. These are just some things that we found along the way, and tips and information and best practices that we thought will be very helpful to you. Do you have any other last words, Giselle? For
No, I think just echoing that, and just again, I think my biggest thing always is that y'all are magic, pregnant people, growing life, taking care of kids and homeschooling, and also working, and also doing a million other things, because that's just what you do. I think taking in a second to realize that y'all are magic, and
I love that.
y'all to be well, and we love y'all, and certainly don't feel sort of shy to reach out to your healthcare professional with as many questions as you have. If you're more of the person that feels like, oh, well, I don't want to bother all the time, make sure you write those questions down and make sure you get those questions answered, because like I said, we need y'all.
Yeah, that's it. And I think that's a great ending point to even just to like take a time to take a deep breath and just say, I am magic.
You
And
are magic.
that's great.
And you got to protect that magic.
You gotta protect that magic because you're magical. That's awesome.
Yeah.
So again, and today is April 1st, which means that it's 401 Gives Day,
Mhm.
and Biff is proudly a part of 401 Gives. And I know that this is like crazy times, but if there's ever a cause that needed support, it's this cause of LunaYou to really help to support the well-being of mothers. And so if you find it in your heart to give and to support LunaYou in any way, consider Biff for and LunaYou for 401 Give. So we're really excited. If you are pregnant and are due anytime between April and December, please reach out to us or go to www.lunayou.com and sign up and register there. Or you can find us on Facebook at I am LunaYou, as well as Twitter, I am LunaYou, and just connect with us. You can also find us and engage us in multiple ways. My name is Courtney Lester on all different platforms, Courtney M. Lester on Instagram, and we'll be sure that we reach out to you. And my email is Courtney@LunaYou.com. So that's pretty simple. Courtney, Courtney, Courtney everywhere. Be sure to find me. We can help you. If you know a mama in need that can really be benefited from having well-being support, please drag her here to this place because we really want to help all people that we can to navigate through this time in such a magical time in their lives. So thank you, Giselle,
Thank
for just your
you.
time, your information. Definitely has not fallen on deaf ears. I think the information is going to go and help us to be better as we navigate these crazy times. So thank
Absolutely. Thank
you.
you for having me.
Yeah. Thanks, everybody. Until next
Bye.
time.